My journey into the health and wellness field began when I was about 15 years old. I was on the track team for my school, and during practice, I was getting this funny feeling in my hip. And at that time, I was competing the long jump. So my teammate and I were going back and forth with jumps, and I really overextended one of the jumps, and I felt my hip almost have a tearing feeling. And it turned out to be a hip flexor strain. So I could barely walk because it was so painful, and it put me out for a while. And I was so focused on recovering just so I could continue moving forward. That was my first injury that really put me off of a team. So months later, the hip is mostly better, but now I have a pain in my low back. And I'm wondering why all these like really nagging injuries are happening to me. And I essentially lived in the athletic training room of my school just because I wanted to get better, just so I could continue to do sports like football and track. So the athletic trainer really took me under his wing, and I became almost obsessed with rehab. And that really set me off into this career that I'm currently in. So I ended up recovering mostly, and I continued to do sports throughout high school. And after about a year or so, everything was back to normal. High school was ending, and it came time to making a decision about what I wanted to do going forward. I wasn't completely sold on one specific thing, but athletic training really stood out to me just because of the experience with the hip injury and the recovery process. Side note, I also auditioned for a couple of jazz studies programs. I played saxophone as well, but at that time, the jazz studies didn't work out, so I decided to focus on health. Athletic training was not in the books for me at that time, so I shifted to something that I learned about when I was about a freshman in college, and that was physical therapy. And this was truly the foundation of my career looking back at it. So I began volunteering in clinics. I also worked at the school gym. I went to Arizona State, so we had a very large facility, and I essentially lived in there just working and exercising. And it became a big passion of mine. I continued to volunteer in clinics, and I even had an internship in an orthopedic clinic. I was really focused on going to physical therapy school just so I could become a physical therapist. At that time, I feel like I had tunnel vision. I wasn't really thinking about much else, if there was other options for me after I graduated college, what other careers or jobs I would pursue. I also found out that physical therapy school was extremely difficult to get into, and I ended up not getting into any schools after applying for 3 to 4 years. I was also working full-time in several orthopedic clinics in the Phoenix, Arizona area. And I had to make a pivot just because things just weren't working out, and I had to keep on progressing. So I got my personal training certificate, and I started working full-time in the gym in Berkeley, California. And after some months, I was looking to make a change again. I don't know if it was the personal training career or where I was working, but all I know is I needed to make another pivot and keep progressing forward. At this time, the COVID pandemic was starting to make its way into our area, and we began working remotely. And I was pretty checked out of personal training at this time, but then I was introduced to public health. I ended up pursuing a master's in public health. This was an extremely valuable time. It opened my eyes to the dynamics of society and how it affects people's health. And I gained a significant appreciation for community health. Over time, I wanted to weave in fitness to public health, as well as public health into fitness. And that's what led me here today. Since graduating from public health school, I've worked in several public health programs, as well as healthcare administration, which I still do today. I started my company, Evolution of Wellness, from a blog. I continue to want to explore various elements of fitness, wellness, and public health, how they tie in together. And ultimately, I wanted to find a way to prevent people from going to physical therapy unless they absolutely needed to. For instance, a hip replacement or a rotator cuff injury. My work with Evolution of Wellness is new. This is my first time running an organization. It is only me, but I'm excited to see how it grows over time. And I'm trying to create the most effective digital tools and guides just to make it easier for people to become healthy and not have to truly depend on the healthcare system to maintain their health. Also, to create positive ways in communities to help people get better as a whole. I'm excited to have you all follow along and stay tuned with the journey.